Diabetes mellitus is a very prevalent disease in our society and is going to rise as day pass by. So what is diabetes? Diabetes is a condition when there is persistently rise of blood sugar, especially glucose in the blood. Glucose we get from our food, and insulin and hormone produced by pancreas helps the glucose to go into the cell, where with the mitochondrial processes, internal processes in the nucleus and others, this is converted into energy. When there is defective glucose production or body cannot utilize it properly, or there is diminished production, so blood glucose level rises in the blood, and this produces diabetes. Diabetes, or long continued diabetes, has got prolonged health problem. Now, normal blood sugar varies from laboratory to laboratory. Fasting blood sugar should be up to 100 in some cases. In some laboratories it's say 110, and postprandial blood sugar is up to 140. So type 1 diabetes occurs when there is absolute reduction in the production of glucose from the pancreas, and those patients have to survive on the basis of regular insulin injection. Oral anti-glucose therapy is not very helpful in these cases. Usually these patients are younger and young children or adolescent people. This diabetes is different from the type 2 diabetes, which occurs in the elderly age group, and most of the diabetics in 90% cases worldwide is type 2 diabetes. Type 2 diabetes occurs when there is less production of glucose from pancreas, or body cannot utilize the glucose produced by pancreas. This phenomenon is known as glucose resistance. There is the insulin resistance, and if it produces for a long time, pancreas goes on producing more insulin, but subsequently it fails, and that produces diabetes, and it should be controlled very strictly from the very beginning. It occurs usually in the adults. Now, gestational diabetes is another terminology where ladies going to the pregnant become pregnant, their blood sugar mainly glucose rises. These patients never had diabetes beforehand, and only during the pregnancy this blood sugar rises. This is known as gestational diabetes. These patients, these ladies, are more prone to subsequently developing diabetes mellitus.